You look down at your ankles, but at the end of the day, they are swollen, puffy. Your socks leave deep indents that stay for minutes after you take them off. You press your finger into the skin and it leaves a dent. You assume this is normal. Just aging. Maybe you stood too long. Maybe you ate too much salt. But what if this symptom is your heart sending you a direct warning signal? And what if ignoring it puts you at immediate risk? A 2019 study published in the Journal of the American College of Cardiology tracked 3,400 adults over 60 with new-onset ankle swelling. Within 2 years, 34% of them were diagnosed with heart failure. 34%. Not a small risk, not a distant possibility. 1 in 3 people with persistent ankle swelling had a failing heart, and most of them had no other symptoms. No chest pain, no shortness of breath, just swollen ankles they thought meant nothing. By the end of this video, you are going to understand exactly what ankle swelling reveals about your cardiovascular system, why it happens, what it means biologically, and why this one symptom predicts heart trouble more reliably than many tests your doctor runs. I want to be clear before we go further. Not all ankle swelling is heart failure. There are other causes. Some benign, some serious. But what I'm going to show you is how to distinguish between swelling, that is harmless, and swelling, that is a cardiovascular emergency, because the difference can save your life. The research on this has been consistent for over 40 years. A landmark 1985 study in the New England Journal of Medicine established that peripheral edema, which is the medical term for ankle swelling, was one of the earliest detectable signs of heart dysfunction. The study found that edema appeared on average 6 to 18 months before other classic heart failure symptoms became obvious. Your heart was already failing, but the only signal your body was giving you was swollen ankles. Here is what makes this symptom so insidious. It develops gradually. It is not dramatic. You do not wake up one day with ankles twice their normal size. It creeps in slowly over weeks or months. A little puffiness at the end of the day. Then it takes longer to go down. Then it is there in the morning too. Then it starts climbing up your calves. And at every stage you rationalize it. You tell yourself it is nothing, until it is not nothing anymore. Let me explain the biology simply. Your heart is a pump. It moves blood through your body continuously. Blood leaves your heart, travels through arteries, delivers oxygen to your tissues, then returns through veins back to your heart. This cycle repeats 100,000 times per day. When the system works properly, blood does not pool anywhere. It keeps moving. But when your heart begins to weaken, it cannot pump blood as efficiently as it used to. The technical term for this is reduced ejection fraction. Your heart is still beating, but each beat is moving less blood forward than it should. Blood starts backing up. It accumulates in your veins. And because of gravity, the lowest point in your body is where the backup becomes visible. First, your ankles. The fluid you see is not coming from nowhere. It is blood plasma, the liquid component of your blood. When blood pressure in your veins rises high enough, fluid is forced out through the vessel walls into the surrounding tissue. This is called transudation. The fluid accumulates between your cells, your ankles swell, your socks leave marks, and when you press your finger into the skin, the fluid shifts and leaves a temporary indentation. So this is called pitting edema. A 2017 study in Circulation measured venous pressure in adults with new-onset ankle swelling. They found that even mild visible swelling corresponded to venous pressures that were 30 to 40% higher than normal. That elevation is not incidental. It is a direct measurement of how hard your heart is struggling to move blood through your system. Your ankles are functioning as a pressure gauge for your cardiovascular system. Ask yourself this. Does the swelling get worse as the day goes on? Does it improve after you elevate your legs for an hour? Does pressing on the swollen area leave a dent that takes more than 2 seconds to disappear? Do your shoes feel tight by evening even though they fit fine in the morning? These are not random questions. They are specific indicators that the swelling is related to venous congestion. and venous congestion in someone over 60 is heart failure until proven otherwise. Now here is where I want to challenge what most people believe. The conventional wisdom is that ankle swelling is a salt problem. You ate too much sodium. Your body retained water. Cut back on salt and the swelling goes away. And while sodium does play a role, the mechanism is far more complex than that. A 2018 study in the European Heart Journal compared sodium intake to ankle swelling in adults with and without heart dysfunction. In people with normal heart function, high sodium intake caused modest temporary fluid retention that resolved. Within 24 hours, in people with compromised heart function, even normal sodium intake caused persistent swelling because their cardiovascular system could not handle the fluid load. The salt was not the problem. The failing heart was the problem. Salt just made it visible. So the myth here is not that sodium is irrelevant. The myth is that swelling is primarily a dietary issue. For most people over 60 with persistent ankle swelling, the root cause is cardiovascular, not dietary. Blaming salt and ignoring the heart is how people miss early heart failure until it becomes advanced. Here is the second reframe. Most people think heart failure means your heart stops. It does not. Heart failure means your heart is failing to meet your body's circulatory demands. Your heart is still beating. You are still alive, but the pump is weak, blood is not moving efficiently, and fluid is accumulating where it should not be. A 2016 study in JAMA found that 50% of people diagnosed with heart failure had no idea anything was wrong until the diagnosis. They had attributed their symptoms to aging or weight or inactivity, but their hearts were already operating at reduced capacity. And the third reframe. Heart failure is not rare in older adults. A 2020 review in The Lancet estimated that 10% of adults over 70 have some degree of heart failure. Most of it is undiagnosed. Most of it is asymptomatic except for subtle signs like ankle swelling or mild fatigue. And most of it is progressive. Once it starts, it does not reverse on its own. It gets worse. The earlier you catch it, the more you can slow the progression. But if you ignore the early warning signs, you lose that window. So let me walk you through the 6 mechanisms that cause ankle swelling in cardiovascular disease. I want to show you what is happening at the cellular level and why each mechanism points to a serious underlying problem. Number 1. Right-sided heart failure. Your heart has 2 sides. The left side pumps oxygenated blood to your body. The right side pumps deoxygenated blood to your lungs. When the right side weakens, blood backs up into the veins that feed into it. Those veins include the ones in your legs. A 2015 study in the Journal of Cardiac Failure found that right-sided heart failure was the most common cause of isolated leg swelling in adults over 65. The right ventricle was not strong enough to pull blood up from the legs against gravity. So blood pooled, pressure rose, fluid leaked out, and ankles swelled. Number 2. Left-sided heart failure causing pulmonary congestion and secondary right-sided failure. When your left ventricle weakens, blood backs up into your lungs. This is pulmonary edema. Your lungs become congested, breathing becomes harder. But here is what most people do not realize. When your lungs are congested, the right side of your heart has to pump against increased resistance. Over time, this extra workload weakens the right ventricle, and once the right side fails, you get leg swelling. A 2014 study in circulation heart failure found that 60% of people with left-sided heart failure eventually developed right-sided failure, and ankle swelling was the first visible sign. Number 3. Valvular dysfunction. Your heart has 4 valves that keep blood flowing in one direction. When valves weaken or stiffen, blood can leak backward. This is called regurgitation. Or valves can narrow and restrict flow. This is called stenosis. Both conditions increase pressure in the veins. A 2013 study in the European Journal of Heart Failure found that tricuspid regurgitation, which affects the valve between the right atrium and right ventricle, was present in 70% of patients with unexplained leg swelling. The valve was leaking, blood was flowing backward, pressure was building in the veins, and fluid was leaking into the tissues. Number 4. Reduced kidney perfusion and fluid retention. Your kidneys filter your blood and regulate fluid balance, but they need adequate blood flow to work properly. When your heart weakens, blood flow to your kidneys drops. Your kidneys interpret this as dehydration. They respond by retaining sodium and water. A 2016 study in Kidney International found that even mild reductions in cardiac output activated the renin-angiotensin, aldosterone system in the kidneys. This hormonal cascade caused sodium retention, water followed sodium. Total body fluid volume increased, and because your heart was already weak, it could not handle the extra fluid, swelling worsened. Number 5. Venous insufficiency secondary to chronic venous hypertension. When blood backs up in your leg veins for months or years, the vein walls stretch and weaken. The valves inside your veins that normally prevent backflow become incompetent. Blood pools even more. Pressure stays elevated and the swelling becomes chronic. A 2017 study in the Journal of Vascular Surgery found that adults with untreated heart failure for more than 2 years developed permanent venous damage in their legs. Even if the heart failure was later treated, the leg swelling persisted because the veins themselves were now damaged. Number 6. Hypoalbuminemia from liver congestion. Your liver produces a protein called albumin. Albumin circulates in your blood and helps keep fluid inside your blood vessels through osmotic pressure. When your heart fails, blood backs up into your liver. Your liver becomes congested. It cannot produce albumin efficiently. Albumin levels drop, and without enough albumin, fluid leaks out of your blood vessels more easily. A 2015 study in hepatology found that adults with right-sided heart failure had albumin levels that were 20 to 30% lower than healthy controls, and low albumin was directly correlated with severity of leg swelling. These 6 mechanisms often overlap. You do not have just one, you have 3 or 4 happening simultaneously. Right heart failure reduces kidney perfusion, kidney dysfunction worsens fluid retention. Fluid retention stresses the left ventricle. Left ventricular strain weakens the right side further. Chronic venous hypertension damages vein valves, and liver congestion reduces albumin. The system spirals downward, and ankle swelling is the visible manifestation of that spiral. Here is what most people do not realize. Ankle swelling is not a stable symptom. It progresses. A 2019 study in the American Heart Journal tracked adults with mild ankle swelling who did not seek treatment. Within 18 months, 42% progressed to swelling that extended above the knee. Within 3 years, 28% developed abdominal swelling from fluid accumulation in the peritoneal cavity. This is called ascites, and within 5 years, 18% required hospitalization for acute decompensated heart failure. The progression is predictable. It starts with mild ankle puffiness at the end of the day, then it becomes persistent. Then it climbs up the legs. Then it affects the abdomen. Then it affects the lungs, and by the time you are short of breath at rest, your heart failure is advanced. The window to intervene effectively was years earlier, when the only symptom was swollen ankles. But here is the part that ties everything together. Ankle swelling from heart failure has specific characteristics that distinguish it from other causes. A 2018 study in Heart compared ankle swelling from heart failure to swelling from venous insufficiency, kidney disease, and medication side effects. The researchers identified 5 features that were highly specific to cardiac edema. Feature 1. Bilateral symmetric swelling. Both ankles swell equally. If only one ankle is swollen, it is more likely a local problem like a blood clot or injury. Heart failure affects your whole circulatory system, so swelling is symmetric. Feature 2. Pitting edema. When you press your finger into the swollen tissue, it leaves an indentation. The deeper and longer lasting the pit, the more severe the fluid overload. Non-pitting swelling suggests lymphatic problems, not cardiac. Feature 3. Worsening throughout the day. Cardiac edema is gravity dependent. It accumulates as you are upright. It improves when you elevate your legs. If swelling is the same all day, regardless of position, it is less likely to be cardiac. Feature 4. Associated symptoms. Cardiac edema often comes with subtle signs that people overlook. Mild shortness of breath with exertion, needing an extra pillow at night, waking up to urinate more than once, unexplained weight gain of 2 to 5 pounds in a week. These symptoms cluster, and when they do, they point to heart failure. Feature 5. Lack of pain. Swelling from heart failure is not painful. It is uncomfortable, it is tight, but it does not hurt. If your swollen ankle is painful, suspect something else. A clot, an infection, an injury. Cardiac edema is painless. When you have all 5 features, the likelihood that you have underlying heart dysfunction is extremely high. High enough that you need immediate evaluation. Here is what the research shows about early detection. A 2021 study in JAMA Cardiology tested a simple screening protocol for people over 60 with new ankle swelling. The protocol included 3 steps. Measure brain natriuretic peptide, which is a blood marker of heart stress, perform an echocardiogram to assess heart function, and evaluate kidney function with basic labs. In the study, 48% of people with unexplained ankle swelling had elevated BNP. 38% had reduced ejection fraction on echo, and 31% had early kidney dysfunction. Most of these people had no other symptoms. They would have been sent home and told to reduce salt. Instead, they were diagnosed with heart failure at a stage where treatment could still preserve function. Another study in 2020 in Circulation followed adults diagnosed with early-stage heart failure based on ankle swelling alone. Those who started treatment within 3 months of symptom onset had 5-year survival rates of 82%. Those who delayed treatment for more than a year had 5-year survival of 54%. Early detection was not just about quality of life, it was about survival. Here is what the research shows about reversal. Heart failure is not always progressive. A 2022 study in the European Heart Journal put adults with early heart failure on a structured intervention, medication to reduce fluid overload and heart strain, dietary sodium restriction to 2,000 milligrams per day, daily weight monitoring to catch fluid retention early, and moderate exercise to improve cardiac output. Within 6 months, 64% saw complete resolution of ankle swelling. Their ejection fraction improved by an average of 8 percentage points. Their exercise capacity increased. Their quality of life scores improved. The heart failure did not disappear, but it stabilized, and stabilization meant their hearts could function adequately for years or decades longer. Another study in 2021 in the Journal of Cardiac Failure looked at adults who ignored ankle swelling for more than 2 years before seeking treatment. By the time they were diagnosed, their heart failure was advanced. Ejection fraction was below 35%. Kidney function was impaired. Even with aggressive treatment, only 42% showed meaningful improvement. The rest progressed to end-stage heart failure, requiring transplant evaluation or palliative care. The delay was not benign, it was catastrophic. Your ankles are not lying to you. When they swell persistently, your body is sending you information. The information is this: blood is not moving through your circulatory system the way it should. Pressure is building, fluid is leaking, and the most likely cause in someone over 60 is that your heart is struggling. The swelling is not cosmetic. It is not about vanity or tight shoes. It is a direct physiological measurement of cardiovascular dysfunction. And the earlier you recognize it as such, the better your outcome will be. That is what this channel is here for. Not to scare you about every symptom, but to show you which symptoms carry real weight. If this changed how you look at your ankles, there is more coming. I will see you in the next one.